He's going to talk about the tough journey of Steven Johnson Syndrome patients made easy.
Good morning, respected judges and the delegates. I will be speaking on basically the patients who had episode of Steven Johnson syndrome in the past, and they have presented to us in the chronic phase of their disease. So I have given the title, The Tough Journey of Steven Johnson Syndrome, Patients Made Easy. So as we know, Steven Johnson syndrome is a life-threatening hypersensitive mucocutaneous reaction which lead to vesicular bullous lesion in the skin and the mucosa. Similarly, it affects the eye in the acute phase also. But as the acute phase passes, if it is not treated with the help of some medical and surgical intervention in the form of amniotic membrane, this acute phase, if not treated properly, can lead to formation of chronic complications. So in acute phase, we can see there is the lid epidermal necrosis, there are conjunctival acute conjunctival chemosis, as well as conjunctival epithelial defects, as well as corneal epithelial defects. So if these are not tackled properly, this may lead to formation of symbolifrons and other problems like stem cell deficiency and severe dry eye. So mainly, if once acute phase is resolved, these chronic surface inflammation lead to lid margin keratinization and other lid margin changes, which lead to cumulated blink related trauma to the ocular surface in the form of these manifestations they present in the chronic phase. So these are our patients who has lid margin keratinization, trichiasis, posterior migration of mucocutaneous junction, symbolifrons, atrophied meibomian glands, non-functioning meibomian glands, tarsal conjunctival keratinization, limbal stem cell deficiency, which may lead to chronic corneal epithelial defects, which may get infected and lead to ulceration and may lead to terminal end stage blindness. So we just went through our patients in the last 4 years who we included 34 eyes of the 17 patients who had these kind of findings. So we made the diagnosis of SJS sequel with the help of this scoring system described by Dr. Swapna Sanbag et al. So this scoring system says that if the score comes more than 5, so we can rule out other common differential diagnoses like OCP, drug-induced cicatrizing conjunctivitis, and chemical injuries. So by following this scoring system, we made the diagnosis of SJS sequel in our patients. So this is one of the representative cases in which we had lid margin changes which were causing corneal diseases like the patient, you can see the SPKs and active ulcer in the left side of the photographs. In the right side of the photograph shows the outcome of the patient after lid margin mucous membrane graft as well as after scleral contact lenses. The patient improved from 6/60 to 6/6 in both eyes. So by doing this intervention in chronic phase, at least we can rehabilitate the patient in the form of relief of symptoms as well as giving good visual outcomes. So total 34 AIOC 17 patients were taken care of, and the mean age was 29.5 years, and 11 out of total 17 patients needed mucous membrane grafting for lid margin disease, and scleral contact lens was applied in 13 of the 17 patients. So just coming to the discussion part of this paper, I want to highlight that cicatrizing conjunctivitis score is a handy tool to differentiate other differential diagnosis of this disease, and intervention focus on chronic stage in the form of mucous membrane graft and scleral contact lens. They give better outcome as compared to the pros alone or mucous membrane graft alone. So we suggest that early lid margin intervention and contact lens changes, if contact lens should be used if we note lid margin changes. So to conclude, SJS patients require routine and long-term follow-up. Any sign of lid-related keratopathy warrants definitive treatment, and excellent outcomes can be achieved in these devastating eyes with meticulous medical, surgical, and scleral contact lens use. Thank you.
Nice study. What was your aim of doing this study? Just to see the chronic, sequelae of SJS, or you wanted to see the outcome of mucous membrane graft or other interventions in these patients?
Basically, it was a medical record analysis just to see whether the patient get benefit after mucous membrane grafting as well as contact lens use in as compared to the no intervention done at all.
So do you find anything novel in this case series? Because mucous membrane grafts and PROS and scleral contact lenses, these all are proven for, these are the modalities to, manage these cases.
Yeah, this
So did you find something new out of it?
basically only few studies are available. Just two groups are working on it. We just analyze our data also, and we could find the same findings that these intervention really help in benefiting the patient as compared to the conservative management as being done till recent times.
So better to operate when it necessary
Yeah.
rather than just leaving the patient on
definitely.
drops.
Yes.
Right.
Thank you.
Thank you.